functional neurologic disorders, and especially conversion disorder. Is there anything to convert, as it is called conversion disorder? I'd like to call it a defend mechanism, as it is. So, it is passing from the stressful situation, acute one, especially to a neurological deficit, or deficits more than one. One of the example could be a child who is treated by parents, and at that time he or she is losing some motor effect, like losing movement of the leg or hand. But you should pay attention, as this is not a fictitious time, or it is not just a moment of getting attention from parents. Let's start with the definition, and it is a disorder in which a person experiences blindness, paralysis, or other symptoms affecting the nervous system that cannot be explained solely by the physical illness or injury. Symptoms usually begin suddenly after a period of emotional or physical distress or psychological conflict. Functional neurologic disorders, it's a newer and broader term that includes what some people call conversion disorder. Feature nervous system or neurological symptoms that cannot be explained by a neurological disease or after a medical condition. However, symptoms are real and cause significant distress or problem with functioning. Symptoms can vary in severity and may come and go or be persistent. So there could be a window like coming and going, or persist at any of the stage of deficit. However, patient cannot intentionally produce or control these symptoms. If to talk about statistical counting, 2 to 5 individuals per every 100,000 patients per every year. Risk factors. So the cause of conversion disorder is unknown, but the condition may be triggered by neurological disorders or disorder, or by a reaction to stress or psychological or physical trauma. But then that's not always the case. Functional neurological disorder or conversion disorder are related to how the brain functions rather than damage to the brain structure, such as stroke, multiple sclerosis, infection, or any type of injury. Some of them are irreversible, but conversion disorder is usually getting back after a period of time. And the risk of factors present having some neurological disease or disorder, such as epilepsy, migraines, and movement disorder. Resent significant stress, so it's all around the stress, emotional, physical, or any type of trauma. Having a mental health condition such as anxiety disorder or mood disorder like depression, dissociative disorder, or certain personality disorders. Having a family member with functional neurological disorder, and possibly having a history of physical or sexual abuse or neglect in childhood. It's time for symptoms, and symptoms of functional neurological disorders may vary depending on the type, and symptoms are significant enough to cause impairment and warrant medical evaluation. Symptoms can affect body movement and function and the senses. Let's discuss firstly body movement and function, symptoms, and after senses. So, weakness and paralysis. Abnormal movement such as tremor or difficulty walking even, loss of balance, difficulty swallowing or feeling a lump in the throat, seizure or episodes of shaking, and apparent loss of consciousness, but seizures are non-epileptic, and episodes of unresponsiveness. And there is a second part called symptoms that affect senses like numbness or loss of touch sensation. Speech problems such as inability to speak or slurred speech. Vision problems like double vision or blindness. And hearing problems or deafness. Diagnosis. There is no test to diagnose conversion disorder. Usually we start by ruling out other physical, mental, or neurological causes of symptoms. Important parts represent patients who had any recent stressful events. The American Psychiatric Association has set standards for symptoms to be diagnosed as conversion disorder. So they affect your movement or senses, and you cannot control them. You are not faking, very important. It's not factitious or malingering disorder. They cannot be explained by any other condition, medication, or behavior. They aren't caused by another mental health problem, and they cause stress in social and work setting. And finally, we get treatment. Simply knowing that you don't have a serious physical condition might be enough to stop the symptoms. Psychotherapy is recommended, like occupational or physical therapy, counseling, hypnosis, antidepressants and antipsychotic drugs. Exercise and calming activity like yoga and meditation may also help. Symptoms can last a few days to several weeks. They might go away as quickly as they come on. Most of the time they are not life-threatening, but they can have lasting effects on quality of life if patients don't get treatment. The best way to prevent conversion disorder is to find good ways to manage life stresses. Once again, exercises and calming activities like yoga and meditation may help. And it looks like, as I said previously, it looks like a defending mechanism. You should understand symptoms when they appear, how to manage and how to handle them, and they can disappear as suddenly as they appear. Thank you very much for your watching and have a good time.